United Lutheran Seminary presents the Seminary Explores podcast, conversations on faith, art, people, politics, theology, life, and more, with voices from around the corner and around the globe.
Welcome to the Seminary Explorers. My name is Nelson Strobert, and my guest today is Mr. Clay Pasqual, who is going to be a senior at Drake University in Des Moines, Iowa. Welcome to the Seminary Explorers.
Welcome. Thanks for having me, Nelson.
Well, it's good. I'm looking forward to our conversation. To begin with, I understand that you were involved in a program this summer in our nation's capital. Which program was that?
So the program I'm in is the Fund for American Studies, and it's TFAS for short, and basically it has several institutes within the program that you can apply for, and I was admitted to the Institute on Business and Governmental Affairs, so that's the institute I'm currently in.
What motivated you to want to spend the summer in hot Washington, D.C.?
Well, I've always been really into politics. I'm majoring in political science and strategic political communication back in my school.
Oh, okay.
So I'm really into politics. I wanted to come out here and network with people out here so I could learn more about how things work in DC and how just gain more expertise on the political process here in DC. Okay. So I'm a political junkie.
Okay, fine.
You know?
But specifically, you were involved in a particular agency.
Right.
Which agency was that?
Right. Well, I'm currently an intern with the Healthcare Leadership Council.
And what do they do? What is their responsibility?
Well, yeah. So the Healthcare Leadership Council is a group of about 50 healthcare companies, and it's a variety of healthcare companies: insurance companies, healthcare distributors, pharmaceutical companies, companies that make medical devices that we use for X-rays and stuff. And so there's about 50 companies in the group. They're represented by their chief executives, and the Healthcare Leadership Council advocates on their behalf to Congress about their issue priorities and what they want to see passed to help improve healthcare for all Americans.
Right. Okay. So that and healthcare certainly is in the news. Mm-hmm. In our newspapers as well as on our television news as well. How do you think your views on healthcare changed while you were here, as an intern?
Well, I think that I now have a lot. I think first off, with the current healthcare debate, we focus a lot on the coverage involved with healthcare. Whether people have insurance, which I think is still really important. But I think also I learned more about the cost element of healthcare and how we need to bring down the underlying things that are driving the cost of healthcare up in order to really address the problem. For example, with the baby boomers retiring now,
right.
There's really an increased need to treat chronic conditions like diabetes and especially Alzheimer's and dementia are increasingly problematic diseases that are affecting old folks and causing rising health costs. So we can start getting ahead of those diseases and finding treatments for those that'll really drive down healthcare costs for everybody and make it a whole lot easier to get everybody covered.
Okay. Now, what was the manner in which they helped you to be informed about these issues? What do they have you do as an intern?
Right. Well, two things basically. One, I worked on a lot of their communications materials, so I would update their talking points that they use for advocating their issues before Congress and before staff people associated with Congress, and helped with their press releases and updating their newsletter templates that they used. And then the other thing was they would send me out to briefings on healthcare issues out in DC and to committee hearings, and then I would write reports on those about what I'd heard. And
could you share some of the what some of those briefings were?
Yeah, well, I think one of the most memorable ones was when I went to this briefing at the Bipartisan Policy Center a week or two ago, and it was about long-term care for elderly folks, because that's an increasingly pressing issue, as I said, with the boomers retiring. So that was really interesting. There was a woman there who told about how she had to care for both of her parents who had gotten dementia, as well as her husband's mother. So 3 out of the 4 of that couple's parents had dementia. And then also the former Senate Majority Leaders were there, Tom Daschle and Bill Frist. So I got to meet him and take selfies. So.
Okay. In getting oriented, it's one thing going to the briefings, but you have to. You're right from school. You're finishing your junior year. You come to Washington. Was there an orientation to Washington D.C. and to the environment that you'd be in? And what was that like? And what was that?
Yeah, well, TFAS was very helpful in like getting me and the other students like acclimated DC. We had this big like DC scavenger hunt we did in our first days here, where they sent us like a bunch of different like sites, like take pictures with stuff so that we know where everything was in DC. We also took a nighttime bus tour of like the Washington Monument, so that we got familiar with the National Mall and stuff happening down there at the Smithsonian, because that's where a lot of people like to spend their time when they're sightseeing. So that was really cool. And then we had our transportation orientation too.
Transportation orientation?
Well,
what was that?
Well, because a lot of folks, they have trouble getting around on public transportation sometimes if not used to it. So learning how to use the metro.
That can be a difficult task.
Yeah, you end up going one way when you go the other way. So.
Right. As you look on this time, it was going to briefings, being oriented, but you also had class, or a class or classes. I don't know.
Yeah, well, I had one class I was taking. I'm just finishing up now. It's on the economics of regulations. And basically what the class is about, like the economic impact of regulations that government agencies put in place, and like whether the regulations do more harm than good in keeping us safe and healthy.
Okay. I guess the question for me, as you did this internship, was how have your ideas about healthcare in these United States changed?
Well, I think just that. First off, like I'm still like a huge supporter of like the Affordable Care Act since like when I got here. But I think like there definitely needs to be like improvements made.
Improvements to the Affordable.
Yeah, to the Affordable Care Act.
Okay.
I think that. Getting more people covered under like Medicaid, because some states still haven't expanded it yet, and also like doing more to build, because the ACA did a lot of stuff. It had a lot of different like experiments it tried to like help bring down costs for healthcare. But there's still more that we can do to bring down the cost of healthcare, because if we bring down the underlying cost of healthcare, then it's going to make it a lot easier to be able to provide it to more people if it's not as costly. Obviously, it's pretty simple math there.
No, well, yeah.
Well, sort of.
Yeah, sort of. But,
sort of.
Yeah,
it's not complicated, actually.
Were there ideas that were shared with you and the other interns about bringing down the costs?
Right. Well, I think. Oh yeah. Well, of course. With prescription drugs, like making sure that people are taking the drugs that they're prescribed, like according to schedule, because that's actually a big problem where people are not like they're not taking their medicine like when they're supposed to be taking it. And so like there's new apps now that are like that hospitals and medical providers are using that help people, that remind them when to like take their medicine. Because if people take their medicine, they're less likely to be admitted to the hospital again, and then you avoid all those hospital costs.
Right. Okay.
So that's a big thing. Like managing conditions, especially chronic conditions, effectively.
Right.
Is key.
Okay, but there are any other ways in which you saw or you heard that we could reduce costs?
Oh yeah, well like telehealth is a new major thing.
Okay, you'll have to explain that to me and to the listening audience.
All right.
What is that?
Everyone knows telephones, so like telehealth is basically like the idea that especially like in rural areas where there's not as many medical facilities and doctors around. It's where specialist doctors can like Skype in to an area and like dispense their medical advice and tell people what they should be doing to keep healthy or address like a certain condition that they're specialized in, instead of the doctor having to come out and visit and treat those patients, because obviously the doctor that's useful, like go out there and treat like one or two patients, but like if there's like a ton of patients in an urban area, it's kind of like, you know, you have to pick and choose here. So with telehealth, it makes it a lot easier to make sure that folks in more rural and sparsely populated areas are getting their needs addressed.
Okay, that sounds interesting, and also one of those necessary things in this day and age, but also making use of technology.
You're right, yeah. Technology is key. I mean, the healthcare industry's had a problem with transitioning from like paper records to like electronic records. So obviously, the sooner we can get to everything really electronicized, if that's a word, the better, because then it'll be easier to make sure that all the patient's information is being kept up to date. And so like, you know, when a patient goes to see like a specialist, like the specialist doesn't have to ask like, oh, what are you here for? They'll already know, because they'll have this electronic record of like their past health history that they can look at. So it's a lot more efficient if we can get the healthcare industry really get all these electronic records up to date.
Right, very much so, very much so. It seems to me that one of the issues is that in terms of healthcare is helping people to understand. You've spent you're in this summer working and getting really background in the healthcare industry. But for those of us, the lay people and non-medical people, you know, it's when we hear this stuff on the news, it becomes very confusing. What do you think, from your experience, what do you think might be helpful for those of us who aren't in the forefront of this industry to understand what is going on in the conversation that we hear on the news?
Right. Well, I think just, first off, like, there's a ton of, like, free webinars online that you can go into and listen to. They'll bring you up to speed on a lot of these healthcare issues and kind of help simplify it. I think also just kind of reading up on the news on like the healthcare issues as they come in is helpful.
In our newspapers, you mean?
Yeah, well, also like online too, especially like there's several websites like The Hill, Politico, the Washington Post, Wall Street Journal that have online, like they have like their health and wellness sections. Their articles are written a lot more in a more simple manner than like some of this jargony language I've been throwing around.
Okay.
That would be a good place to start, I feel like, with those kind of new online news outlets, and then maybe move into like some of these free webinars I was referring to.
Okay. As we're involved in this conversation, I'm curious as to what do you think the benefits have been for you involved in this program?
Yeah, well, there's been a lot of benefits. One, just like getting to know DC and looking around it, so if I end up moving here later, I'm already really well acquainted with the city.
Right.
Obviously, the networking has been key, like meeting up with all sorts of different people across the political spectrum and getting to know them. Obviously, the Healthcare Leadership Council has been great for giving me a much deeper understanding of healthcare issues than I had coming in here with all these briefings I've attended. Right. So I have a lot.
How did that
I feel a lot more wonkier now than I was when I got here.
Okay, how did that change for you?
It changed. You mean
your ideas about healthcare?
Right. Well, I mean, it changed. Like, it just made me realize like how how even more complicated the healthcare system is than I thought going in, or how many different new phenomena are arising that can really change the future of healthcare that we never hear about in the news, like telehealth and also the social determinants of health. I haven't brought that up yet.
Yeah, say something about that.
Right. Well, yeah, social determinants of health. Basically, it's looking at like socioeconomic factors. For communities people are living in, and seeing how those can like shape how their health turns out. Like obviously their income, also like their education level, and like what kind of food they're getting from the supermarket and stuff. And also like whether they have like open community spaces for like exercise and stuff, like nice parks and stuff. Like yeah,
I don't. Somehow I don't think about those things.
Right.
Healthcare. I think about the doctor and the office visit and the hospital. That's part of the
problem. Like folks are so concentrated on like just the actual like medical care that like we're not looking enough at these socioeconomic determinants that come before you get to the doctor's office that could like improve your overall quality of life and keep you from having to get medical care in the first place. It's like another form of preventative care, except when we refer to preventative care, we normally mean like prescription drugs and like vaccines and colonoscopies, etc.
Right,
mammograms.
Exactly. You accumulate a lot of information.
Yeah.
You experience the briefings, etc. Was there anything during this period that troubled you, or that disturbed you, or that challenged you?
Well, right. I mean, in regards to healthcare, obviously, I'm really troubled by like how like partisan the debate is right now, and that we literally have like we don't have much or really any cooperation right now between the parties to like improve the healthcare system. Like, I mean, this debate we've been having the past few months is actually, like, even without a bill being passed, it's harmed the healthcare sector because it's caused a lot of uncertainty for insurance companies.
Right.
So they're raising their premiums for people, so it's going to make insurance more costly for people who are enrolling in the healthcare marketplaces later this year and into next year, whether or not a Trump care, as they call it, is passed. So it really, I would hope that once the Trump care bill is finally defeated, that Democrats and Republicans can come together and pursue some more bipartisan solutions to health care, because I think that's the direction we need to go in. So.
Okay, so the partisanism that's taken place has really been problematic for you and for the rest of the country.
Mm-hmm.
Very much so. Now you're finishing up this internship, and I'd like to know, have you thought about what you're going to do in your senior year? Has that affected what courses you might take in your senior year, and the course of your own vocation?
Right. Well, yeah, definitely. I'm already thinking about. So I have to write my honors thesis in the fall for the honors program I'm in at my school, and I'm thinking I'm going to write it about like the social determinants of health that we were discussing earlier, because it seems like there's a lot going on in that field. I just Googled it the other day, and there's like just a ton of scholarly articles about it. So
okay, good.
There's definitely a lot of material to work with, and it's a 30-page thesis, so it better be. So I think that's already one way that this experience has kind of affected what I'm going to do my senior year. This was kind of before I got here, but there's a kind of a student-run think tank that's being formed on my campus, and they wanted me to join it and work on like healthcare issues, and so now that I have all this additional experience, that would really help me with this new effort.
Very much so. And for those in your own age group, or parents or children in your age group, what do you think the benefit of being in this program or similar program around the country? What is the benefit for the college student?
Well, I think obviously there's the networking aspect. Also, it gives the college student a chance to really see like what they enjoy and like what they don't enjoy about DC and like politics or whatever field in particular they were coming here for DC for. So it kind of helps with the process of elimination too, of like what your future possibilities are, so that you don't, after you graduate, you come to DC, it turns out you don't like what you're doing, like, then it's kind of difficult. But so it just gives a good sense of like what you're going to do after school coming here before you graduate.
Well, I can't believe our time has run out.
Yeah.
But I want to thank you for sharing your time with us.
Well, thank you, Nelson. I really appreciate it.
My guest today has been Clay Pasqual, a senior at Drake University in Des Moines, Iowa. And he was an intern this summer in Washington, D.C. and worked in the healthcare issues. For the Seminary Explorers, this is Nelson Strobert. Have a good day.
You have been listening to The Seminary Explorers, a production of United Lutheran Seminary with campuses in Gettysburg, Pennsylvania and Philadelphia, Pennsylvania. We invite you to visit our website at unitedlutheranseminary.edu. Opinions expressed on this program are not necessarily those of United Lutheran Seminary or the Evangelical Lutheran Church in America.